You are welcome to Claribel Health Hub. On our episode today, we are looking at breast self-examination, giving your own self the examination of your breast. And then, what are the times for us to do breast examination? You can do it any day, anytime, but it's recommended that you do it every month, a particular time of the month. For ladies who are menstruating, it's recommended that immediately after your menses, a day after your menses, by which time most of your hormones are on their lower levels, it's better to examine your breast and take note of the changes. For those around menopause, it's appropriate to take a particular time of the month. If you are still menstruating, you can follow the recommendation given earlier. But then if you are no more menstruating or your menses have become that irregular, it's probably once every 2 months, once every 3 months, then it's recommended that you take a particular time of the month. Let's say every first of every month, every fifth of the month, every sixth of the month. That's when you want to give yourself breast examination. For men and those who have menopause, it's recommended that you do it on a particular day in the month. So let's say, like we said, like first, second, third, any day of the month, but then let it be that consistent and regular. And in giving yourself breast examination, you should be in your birthday suit. Without any clothing on. In the shower, when you have water on yourself, the body is quite smoother. And then you'll be able to assess and tell any changes that has taken place. The other place we can also do breast examination is while standing in front of a mirror right after shower. And we can still do it while lying down without a pillow beneath our heads. So when you are going to do breast examination, let's remember this. You take a good look at both of your breasts, taking note of their shapes, taking note of the color. Usually around the breast, they usually have one color. If it's pink all through. If it is brown, it's brown all. And then when you're getting a bit into the center of it, where we call the nipple, you have a much darker skin. Then you have the protruding part, which we call the much darker skin is where we call the areola. And then the small pigmented part of the breast, we call the nipple. So when you take a look at them, you see that the colors are usually not the same. However, we expect that where the color is brown will be brown all around, and where you have a darker skin should also be dark, and then the nipple should also be regular as possible. And virtually, you will find them the same. They wouldn't always be in the same alignment. One is usually lower than the other. After taking note of this, you realize that one of your breasts is also heavier and they are slightly heavier. They are not so pronounced. However, in some individuals, these changes, there could be changes in the breast tissue so much that they affect the skin. Like you are seeing your breast, the skin on your breast looking like an orange peel. As a kutu hona aye rough, something like that. Like an orange, which is a bit rough with those spots or inward kind of. If you realize that your nipple has suddenly become inverted, don't forget, please seek medical attention immediately. Or you are realizing that a particular part of the breast is aching, it's painful, it has become too red, it has become too dark. Anything that you are not comfortable, please don't let us stay at home. Let's report to the nearest health facility. So we're coming to the examination itself. I'm standing in front of a mirror. Let's say I'm standing in front of a mirror. And this is what happens. I want to examine my left breast first. So my left hand goes to the back of my head, and with my right hand, you put all your fingers together to form a flat surface with which you are going to examine your breast. Don't forget, you are examining the whole breast, going all around it, including your chest and out, up in your neck area, all the way down. And then you go down the breast all around it, all round, 2 or 3 rounds to ensure that you have covered the whole breast Then you come to your areola, check for any changes. Then you press the areola and see if anything is coming out of the nipple. We usually don't expect to see anything if you are not breastfeeding, if you have not missed a pregnancy and everything is intact. We don't expect to see water in your nipple. And then don't forget, you have to go all the way as well into your armpit, examining the whole part and going into the center part of it. Press it down and see if there is anything that it might escape you. We don't want to lose out anything. So from there, you remove your left. We are going now to examine our right breast. So with the left hand, with the right hand behind our neck, our head, we use the palm, precisely putting all fingers together, and that is the part we are going to use to examine. We go all around as well like we did to the left breast. Now we are going to the right and all the way. Take note of any pain, any strange thing you are seeing. Take note, take note. Don't forget, we are going all the way into our neck, down into the chest area around the breast, and we'll do 2 or 3 rounds to ensure that we have covered the whole breast. And then we'll go back to the areola, press the nipple, nothing comes out. If there is water, please clear. Take note of the water and report. And don't forget, you are not done. You have to go all the way into your armpit as well and examine your armpit. Okay, I didn't find anything. Hooray, I'm through for this month. I believe you are going to do this. You can do it, what I just did, right in front of your mirror, whilst lying down or whilst in the bath, or when you are taking your shower. You can do it. Wishing you the very best. And let's not forget, couples, let's give ourselves from time to time. Let's give ourselves the breast examination. Like the husband giving the wife breast examination and the wife giving the husband breast examination. I know it will lead to a whole lot of things, but don't worry, you are a couple. Enjoy all that comes with it. And remember, it has been Clarice on Claribel Health Hub. See you in our next episode.